Oplan kalusugan sa DepEd. Halina't alamin atin ang tuklasin, mga health programs ating palaganapin. Tara na okay na okay. Oplan kalusugan sa DepEd. Halina't alamin atin ang tuklasin, mga health programs ating palaganapin. School-based feeding program ating pagtibayin. Wastong pagkain ating ihahain, mga batang kulang sa timbang. Ating pakakainin ng Go, Grow, and Glow. Adolescent reproductive health ay gawing gabay at patnubay ng batang mausisa ay di maranasan. Ang early pregnancy ay maiiwasan. Kalusugan ay mahalaga sa edukasyon ng mga bata. Tayo na't magkaisa, halina tayo'y sumama. Tara na okay. Oplan kalusugan sa DepEd. Halina't alamin atin ang tuklasin, mga health programs ating palaganapin. Tara na okay. Oplan kalusugan sa DepEd. Halina't alamin atin ang tuklasin, mga health programs ating palaganapin. National Drug Education Program or NDE kung tawagin. Ito'y paigtingin mga bisyo'y alisin. Sigarilyo at droga'y dapat nang buksain. Water sanitation and hygiene in schools ating kompletuhin, 3 stars ay abutin. Malinis na tubig, segregated na toilet, group hand washing at may napkin na rin. Kalusugan ay mahalaga sa edukasyon ng mga bata. Tayo na't magkaisa, halina tayo'y sumama. Okay. Oplan kalusugan sa DepEd. Halina't alamin atin ang tuklasin, mga health programs ating palaganapin. Tara na okay. Oplan kalusugan sa DepEd. Halina't alamin atin ang tuklasin, mga health programs ating palaganapin. Medical, dental, and nursing services
of side effects ay agad balik sa eskwela.
Atin ang tuklasin, mga health programs ating palaganapin. Tara na okay. Oplan kalusugan sa DepEd. Halina't alamin atin ang tuklasin, mga health programs ating palaganapin. School-based feeding program ating pagtibayin. Wastong pagkain ating ihahain, mga batang kulang sa timbang. Ating pakakainin ng Go, Grow, and Glow. Adolescent reproductive health ay gawing gabay at patnubay ng batang mausisa ay di maranasan. Ang early pregnancy ay maiiwasan. Kalusugan ay mahalaga sa edukasyon ng mga bata. Tayo na't magkaisa, halina tayo'y sumama. Tara na, okay na okay. Oplan kalusugan sa DepEd. Halina't alamin atin ang tuklasin, mga health programs ating palaganapin. Tara na, okay na okay. Oplan kalusugan sa DepEd. Halina't alamin atin ang tuklasin, mga health programs ating palaganapin. National Drug Education Program or NDEP kung tawagin. Ito'y paigtingin, mga bisyo'y alisin, sigarilyo at droga'y dapat nang puksain. Water, sanitation and hygiene in schools, ating kompletuhin, 3 stars ay abutin. Malinis na tubig, segregated na toilet, group hand washing at may napkin na rin. Kalusugan ay mahalaga sa edukasyon ng mga bata. Tayo na't magkaisa, halina tayo'y sumama. Tara na, okay na okay. Oplan kalusugan sa DepEd. Halina't alamin atin ang tuklasin, mga health programs ating palaganapin. Tara na, okay na okay. Oplan kalusugan sa DepEd. Halina't alamin atin ang tuklasin, mga health programs ating palaganapin. Medical, dental, and nursing services na ating ding binibigay upang matugunan problema ang pangkalusugan ng mga guro at kabataan. School mental health program, kamalayan ito'y bigyang diin. Kaisipang malusog para sa akin at sa'yo, kabataan at guro, tara usap tayo. Kalusugan ay mahalaga sa edukasyon ng mga bata. Tayo na't magkaisa, halina tayo'y sumama. Tara na, okay na okay. Oplan kalusugan sa DepEd. Halina't alamin atin ang tuklasin, mga health programs ating palaganapin. Tara na, okay na okay. Oplan kalusugan sa DepEd. Halina't alamin atin ang tuklasin, mga health programs ating palaganapin. Tara na, okay na okay. Oplan kalusugan sa DepEd. Halina't alamin atin ang tuklasin, mga health programs ating palaganapin. Okay talaga sa DepEd. Okay talaga sa DepEd.
Mga kababayan, let's place our right hand on the left side of our chest and let's all sing together the Philippine National Anthem, to be followed by a prayer.
Mga kababayan, ang pambansang awit ng Pilipinas.
Dear God, kayo po ang pinaka-understanding and pinaka-powerful. Kami po ay nagpapasalamat sa buhay pong binigay niyo po sa amin. Ngayon po ay nagsasama-sama ang mga taong different ang religions. Pero po sincerely po kami nagdadasal upang kami po ay maging united para makuha po namin ang aming goal. Gawin mo po kaming instrument ng love, light, and peace. Gabayan niyo po kami para po masundan namin ang inyong daan sa isang peaceful community at maging source ng happiness and hope sa isa't isa. Wish ko lang po maging nice ang place na ito sa lahat ng tao. Sa inyong kalooban at paggabay, sana po maging tulong ang activity na ito para mag-benefit ng marami. Gawin mo pong ligtas at malayo sa anumang sakit ang bawat isa sa amin. Kasi po, scary po ang pandemic. Marami pong salamat, God. At mahal po namin kayo. Amen.
Three, two, one. Tara na, okay. Sa DepEd, di ba? Isang masaya at malusog na pamilya po sa lahat. Nakita po tayo muli. Thank you for joining us this afternoon for our Oplan Kalusugan sa DepEd One Health Week celebration. I am Sir Avenger, your happy teacher broadcaster at isa po sa mga host nyo ngayong hapon na ito.
So it's great to be with you today, Teacher Avenger, and I am Ivy, mas malusog na version this year, your co-host from the Bureau of Learner Support Services, School Health Division. So happy One Health Week po sa lahat. Yes. For the last 3 days, na-feature na po natin ang medical nursing services, wash-in schools, school-based feeding program, and now, it's time to highlight naman po ang adolescent reproductive health program. So, Teacher Avenger, matanong na kita, how
Yes.
did your school po before celebrate One Health Week?
Naku, nung bago pa ang pandemic, naalala ko, Miss Ivy, no, na talagang nagkakaroon kami ng mga contest, meron tayong mga short film, ang mga bata din ay nag-engage into different activities na talagang makakatulong sa kanilang health. And gustong-gusto ko yung part na sa Division of Navotas, we are doing our sharing of best practices. Ayan, ganyan sa akin, Miss Ivy. Kaya nakakatuwa na kahit ngayon may pandemic, tuloy pa rin ang ating pagpapaunlak sa mga kabataan na gabayan sila sa kanilang kalusugan.
Ang galing naman sa inyo para sa Navotas. Ang galing na, sir. So,
and Miss Ivy, no, ngayon, namimiss ko na talaga ang schools at yung maging kasama yung mga estudyante. Pero, buti na lang, right now, we are joined by our students and of course, yung mga nanonood dyan, ang ating mga kaguruan, teaching, non-teaching personnel. Kaya, nais kong bumati, Miss Ivy, batiin na. Kasi nakita ko, yeah, we have from SDO Baguio, SDO Pangasinan, SDO Dagupan, Pampanga, buong bansa ata ito, Miss Ivy. Buong bansa.
pagbatiin natin sila, yun na lang yung program natin, ano natin siya. Pero yan, salamat sa lahat ng mga nakatubak ngayong araw dito sa ating programa. Tuning in as well ang ating mga DepEd's very own health and nutrition personnel, and of course, ang mga masisipag natin ERH program coordinators at the region, division, district, and school level. So hello po sa inyong lahat. Marami na po akong makikita sa ating comment box. So thank you po for joining us this afternoon. So we also want to welcome in this program our partners po sa ating programa ito. From the national and local level din po, meron po tayo from the Department of Health, Commission on Population and Development, and also our development partners from USAID and Reach Health. So, alam ko meron pa sana mga nanonood from other organizations and agencies. So, comment lang po kayo if nanonood po kayo sa program natin ito.
Ang sarap ng feeling ng Miss Ivy, na yung marinig mo yung mga pangalan ng mga agencies na talagang masasabi mo, hindi ka nag-iisa. Ayan, para sa bata, para sa bayan, hindi po tayo nag-iisa. So, ngayon po, hit the thumbs up button. Yung mga ating mga nanonood ngayon, kung kayo pa from Luzon, heart react naman from Visayas at sa mga kaibigan natin from Mindanao, hit the care button. Kahit saan man po kayo nanonood, sama-sama tayo. Your teachers, at sa mga nanonood ngayon, ulit natin, hindi po kayo nag-iisa. We are one in this fight for our health. As what our 2021 theme said, bayanihan para sa kalusugan, okay sa DepEd, sa paaralan, at sa tahanan.
Tama, partner. So this afternoon, we will be launching the Comprehensive Sexuality Education, Adolescent Reproductive Health Convergence. So virtual talk po sa ating lahat. Ayan. We believe that education does not stop in class, kaya dapat meron mga support mechanism sa ating mga community. And also, our students should have access to reproductive health services. Saan man po din sila magpunta. Ito ang dahilan natin para isulong ang convergence programs with our dear partners. So more on that in a while, kaya tutok po tayong lahat.
Okay. So Ms. Ivy, huwag natin patagalin pa. To formally start the program, let us hear from two of the Department of Education's leaders. First is the Undersecretary of Administration. Please welcome Undersecretary Alain Del B. Pasqua to give his opening remarks.
Isang magandang araw sa inyong lahat. 3 taon na nang simula ng kagawaran ang Offline Kalusugan sa DepEd o OK sa DepEd. At pinagtitibay ang implementation ng ating mga programang pangkalusugan sa tulong ng mga pampubliko at mga pribadong organisasyon tulad ng Department of Health, Commission on Population and Development at ang USAID. Tayo ay patuloy na nagkakaisa lalo na sa panahon ng pandemya upang matugunan ang pangangailangang pangkalusugan ng ating mga mag-aaral. Isa sa mga programa sa ilalim ng OK sa DepEd ang Adolescent Reproductive Health o ARH na siyang focus natin ngayong ika-4 na araw ng ating One Health Week. Sa ARH, tinatalakay natin kung paano tayo makakatulong sa pagresolba sa ilan sa mga suliranin ng ating bansa. Teenage pregnancy, pagtaas ng bilang ng may HIV at AIDS, at ang pagkalatang kalusugan ng ating mga kabataan. Ditong mga nakaraang taon, aktibo tayo sa advokasya at pagpapalaganap ng tamang impormasyon ukol sa mga ito. May mga mental health programs din na ginagawa ang kagawaran para sa ating mga mag-aaral. Kasama na ang patuloy na pagpapalakas sa ating guidance and counseling services upang matugunan ang mga isyong ito na kinakaharap ng ating mga kabataan. Ang pangalaga sa ating mga mag-aaral ay hindi natatapos lamang sa pagbibigay sa kanila ng mga aralin sa mga libro. Nais nating gamitin nila ang kanilang mga natututunan sa kanilang pang-araw-araw na buhay. Nais natin na bigyan sila ng kapangyarihan upang makapagdesisyon ng tama para sa kanilang reproductive health. at sa kanilang hinaharap sa pamamagitan ng pagbibigay sa kanila ng kaukulang impormasyon. Pinapalakas natin ang ating curriculum and instruction para sa mga usaping ito sa pamamagitan ng Comprehensive Sexuality Education or CSE. Ngunit bukod pa rito, sinisikap din natin mabigyan ang ating mga mag-aaral ng mas madaling access sa mga health service providers sa kanilang komunidad. Ang holistic approach na ito, ang CSE at ARH convergence, ay inilulunsad natin ngayong araw na ito. Katulad ng ating tema para sa One Health Week, bayanihan para sa kalusugan, okay sa DepEd, sa paaralan, at sa tahanan, talakayin natin kung paano tayo patuloy na magkakapit kamay sa pagtataguyod ng reproductive and holistic health ng ating mga mag-aaral ngayong darating na school year at sa marami pang taong darating. Salamat sa pagiging bahagi ng One Health Week at okay sa DepEd para sa malusog at masayang pamilyang Pilipino. Para sa inyo lahat, mabuhay po kayo, mabuhay po tayong lahat.
Mabuhay ito at maraming salamat po sa Kalibas.
Thank you po, Yusek Lindel Paspa for that message. So, tumatak lang sa akin na sinabi niya dapat holistic din talaga ang pagtingin natin sa ating pag-respond sa health ng ating mga kabataan. So, next po, we will be hearing from the Undersecretary of Curriculum and Instruction, Undersecretary Diosdado and San Antonio.
The curriculum and instruction strand is very glad to be a part of this initiative to really make sure that the comprehensive sexuality education, adolescent reproductive health program convergence with Oplan Kalusugan sa DepEd happens with more efforts to collaborate and work together in ensuring that the youngsters, our learners are able to be equipped with necessary competencies, skills, knowledge, and attitudes that will make them behave in responsible ways relative to sexuality, and while they also prepare to learn more skills for productive citizenship. Thank you very much to the organizers of this effort for convergence. Mabuhay po kayo and God bless.
Mabuhay din po and God bless po, Yusek Diosdado, San Antonio. Alam mo, partner, we would like to thank these undersecretaries of education for working tirelessly during this time of pandemic. And of course, sa ating pong mother of the Department of Education, Secretary Leonor Magtolis Briones, for continuously fighting for education despite the difficulties ng ating situation na kinakaharap ngayon. Kaya sabi nga po ng ating mother in education, tuloy ang edukasyon. Right, partner?
Yes, tuloy na tuloy. Madaming challenges, but we are happy and glad na talagang nagpupursige po ang ating mga frontliners in education in giving quality services for our learners po. And aside from that, hindi lang sa education na talaga sila nakatuto, pero ina-address din nila ang priority issues ng mga kabataan na yan, katulad nga nitong teenage pregnancy at HIV and AIDS. So naalala ko noong 2018, halos sabay nilabas nga yung department order para sa Oplan Kalusugan sa DepEd under the administration strand at ang comprehensive sexuality education under naman sa curriculum and instruction strand. At ngayon nga, pinagtitibay natin yung dalawang major programs of the department.
Tama. At alam mo, Ms. Ivy, no, habang nagbabago ang panahon, dapat tuloy din tayo sa agos nito. And of course, sa usapin ng sexuality education and ng ating kalusugan, dapat ma-address din natin ang mga pangangailangan ng mga makabagong kabataan. Siguro marami nagtatanong, bakit nga ba kailangan natin ng CSE, ARH convergence, hindi po ito internet, for that, the Commission on Population and Development prepared a video for a Philippine situationer on adolescent reproductive health.
And to explain also yung EO 141 or yung Executive Order 141, which is bagong labas lang from the Office of the President. We are honored to have Executive Director of the Commission of Population and Development, Undersecretary Juan Antonio Perez III.
Filipino adolescents occupy a big part in our society, and they play an important role in nation building. They have potential that can be tapped to help our country move towards progress. Of the more than 100 million Filipinos, 1 in 10 are adolescents, aged 10 to 19, or more than 20 million young Filipinos. While they are a force to reckon with, they are currently faced with different problems and threats that undermine their health and well-being. One of the serious issues facing young Filipinos is early pregnancy. Teenage pregnancy among Filipinos remains high and is now considered as a national social emergency. Based on the 2017 National Demographic and Health Survey, 9% of Filipinos aged 15 to 19 were pregnant or have already given birth. There is an increasing trend in the number of teens aged 10 to 14 giving birth and in the number of repeat pregnancies. Second pregnancy among these young girls. About 2,250 live births from very young adolescent mothers were reported in 2018. Data from 2011 to 2018 show a generally increasing pattern in the number of repeat pregnancies, second pregnancy, among minor mothers. These alarming data places the Philippines at one of the top spots of countries with the highest rate of teen pregnancy in Southeast Asia. The increasing incidence of adolescent pregnancy in the country is primarily caused by increasing exposure to sexual risk behaviors.
Natakot kasi yung pag-aaral ko. Natakot ako syempre kung ano sasabihin ng papa ko o kaya ng mga ibang tao sa akin. Nung nalaman kong buntis ako, natatakot ako na tapos hindi ko alam kung anong gagawin ko. Oo, sorry kasi yung time na pinanginaan ako ng loob. Sa dalawang baby ko, pinanginaan ako ng loob. Kasi ako gusto ko talaga nun that time. Kasi 3 months pa lang siya ipalaglag. Sabi ko, kung napapanood ko ng cases, sabi ko siguro, I'm sorry. Kasi naisip ko yun. Hindi ko ginusto yun. Nga sana maging mabuting anak at saka mabuti silang bata paglaki.
These are mere realities faced by Filipino adolescents. But what is being done to enable them to face such challenges? As duty bearers of the society, we need to prioritize their needs and invest in them so that they can achieve their full potential for their health and well-being. They are important because they are our future innovators, leaders, and agents of change. Imagine every sector of the society in the country working together in the reduction of teen pregnancies, a different picture and a different reality. They will be equipped with appropriate knowledge and life skills. They will have access to reproductive health services. Eventually, there will be no more children having children. Working together to fight this issue will not only change many adolescents' stories and future for the better, but most importantly, we will be laying the foundation for a stronger and a developed nation. Shaping and investing in our adolescents' future will reap us great benefits in the years to come. Will you join us in investing in our youth? Are you up for the challenge?
Healthy Pilipinas. Maupay nga kulop. Mayong hapon kaninyong tanan. Thank you for allowing Popcom to join you in this meeting. And today, this afternoon, I will discuss Executive Order 141, recently issued by the President actually 2 months ago, almost a little over 2 months ago, at the end of June 2021. EO 141 adopts as a national priority the implementation of measures to address the root causes of a rising number of teenage pregnancies. So it's very important for us to keep in mind that this is really directed to national and local government agencies to come together and address this increasing number of teen and very young adolescent pregnancies in the country. Legally, this executive order is aligned with Republic Act 10354, or the Responsible Parenthood and Reproductive Health Act of 2012. And it is also aligned with the Philippine Development Plan and its updated version, particularly the updated version of the Philippine Development Plan from 2020 to 2022. It's also in line with the Philippine Youth Development Plan 2017 to 2022. It's also important for us to recognize why adolescent pregnancy today in the country is a national priority. And when you talk about number of births among adolescents, we are looking at two age groups, yung 10 to 14 and 15 to 19. We note that in the same time periods, the births among adolescents 15 to 19 have gradually started to come down. But this was only because POPCOM and other agencies have started to campaign for the recognition of teen pregnancy as a national social emergency. This has led to a decline, a slight decline, but we all recognize that is not enough when we're looking at 178,000 live births among 15 to 19-year-olds in 1 year. On the other hand, among the very young adolescents, we have seen a continuing climb for the last 4 years, from 2016, from 1,903 to 2,411. So today we are looking at 7 live births among children 10 to 14 years old being born every day in 2019, with the number at 2,411, which is triple the number it was from 10 years before. A study from the UP Population Institute and the UN Population Fund, UNFPA Philippines, showed that the number of unintended pregnancies among 15 to 19-year-old women is expected to go up because of the continuing quarantines due to COVID. Last year, it was estimated that the increase with community quarantine would be at around 21.04%. This year, as we are seeing more cases and even more longer periods for quarantine, we expect the same situation will also hold. So 2 years in a row, we expect to see increases in unintended pregnancies among adolescents. And it has been pointed out by the UP Population Institute that this is more likely to happen if the adolescent is living in with a partner, and if services are not provided to these adolescent mothers, the likelihood of a second, third, or fourth pregnancy is very possible, and they may be the ones who will be contributing to the 20% increase. So among adolescent mothers, there is this possibility of increasing numbers of unintended pregnancies. To address this, the Executive Order 141 aims to achieve in this country well-informed, empowered, healthy, and responsible adolescents. There are 20 plus million adolescents in the country at this time. And this is really the number of our target population when we talk about addressing teen pregnancy among adolescents, because any one of them could be pregnant with an unplanned pregnancy. To address this, there are 5 pillars that we would like to strengthen, to build up, and even to create, so that we can indeed lift up well-empowered, well-informed, empowered, healthy, and responsible adolescents. These are through education, through services of family planning and maternal newborn child health, by addressing anti-violence against women and children, by addressing that and eliminating, if not reducing that. Also, socio-economic development interventions are necessary, as this affects mainly the poor. And finally, we want to offer a bright future for all our adolescents as they move from adolescence to youth, becoming citizens and productive elements of society. We want them to get the best start possible. And all of these 5 will be included in our actions to implement EO 141. So a more detailed strategic framework would include, at the very end, as I said, the impact is improved well-being and empowerment. To do that, we will improve the health of adolescents and children, as well as nutritionally improve their situation, improve education and skills training, increase employment productivity and lifetime earnings, and increased investment for self and child development. The outcomes that will support that impact will be reduced number of teen pregnancies from the outset, a smaller number of teenage pregnancies. We are seeing 178,000 now. That should be reduced to at least 50%. Also, reducing the number of repeat pregnancies among adolescent mothers so that they are no longer a problem. So that would mean from 2,400 that we are seeing now, for about 5,000 that we are seeing right now for repeat pregnancies, that should be almost zero. So all adolescent mothers must be offered the services that can support this desired outcome. That would mean that we should see a reduced incidence of unprotected sexual activities among adolescents, reduced incidence of abuse, sexual abuse among adolescents, and improved health-seeking behavior and a healthier lifestyle for all our 25 million adolescents, and everyone with reduced non-sexual risk behaviors, which include smoking, drinking, the use of drugs, and improved life skills for those who are about to transition to a youth, to become young citizens of this country. Our strategy specifically will involve comprehensive sexuality education, which is already being done by DepEd through the Bureau of Curriculum Development, and access to reproductive health information and services, family planning, maternal newborn child health, child adolescent health and nutrition. And to some extent, this will be addressed by the Bureau of Health Services in DepEd. So this is the linkage that we would like to see, that CSE and information and services on reproductive health are happening hand in hand in all schools in the country. Now, outside of that, at the community level, we want to see access to anti-voucher services through a strong referral system where every possible incidence of violence against women and children who are very young, adolescents who become pregnant in particular, and any incidents of violence during pregnancy of adolescents is reported and given support, or the impact is reduced of this violence. Also, we need to develop socioeconomic intervention, development interventions for the 50% of the adolescent mothers who are poorest. And the numbers here are 166,000 families led by minors who are mothers every year in this country. So we need to provide support to all 166,000. And finally, all of these young mothers with children should have a better future if they're able to be provided with support for youth participation and development. So these prevention and social protection strategies will be implemented by different government agencies and coordinated by a secretariat headed by the Human Development Poverty Reduction Cluster, where the NAPSI, National Anti-Poverty Commission, National Youth Commission, Center for the Welfare, Council for the Welfare of Children, and the Commission on Population and Development will be the key agencies coordinating policies, planning and budgeting, capacity building, communication promotion strategies, and service provision. And for this, we need good leadership and governance across all local governments and institutions involved in this project, in this work. Good data, information, and in the knowledge management of the situation as it is happening in the field. And finally, the community and stakeholders, parents, young people, educators, church people, faith-based organizations, civil society organizations, government agencies, all working together to support this strategic framework. So if we focus ourselves on this work in the next few years, we believe we can make a very big dent in the area of reducing teen pregnancies in this country and addressing the root causes that lead to that situation. Maraming salamat sa inyong pakikinig. Daghang salamat sa iyong paminaw. Daghang salamat. Empowering Filipino families. That is the aim of the Commission on Population and Development. Thank you very much. Magandang hapon.
Thank you, USEC GP, for a brief but clear explanation of EO 141. So gusto ko rin yung motto na POPCOM, Empowering Filipino Families. So magkukwento lang ako, Teacher Abanjel, ng slight lang.
Yes, partner.
So naalala ko lang, last 2019, nagkaroon tayo ng Kapit Kamay Summit wherein ang daming government and non-government organizations kasama ang mga youth po natin, ang mga kabataan natin from all over the country na nagtipon-tipon at nag-commit para ma-address yung teenage pregnancy situation ng ating country. At ngayon nga, nandito na po yung EO 141 kung saan maglalatag po tayo ng comprehensive action plan para ma-address ang teenage pregnancy concern. Nandun na yung commitment at nandito na yung plan. Magkakaroon na tayo ng plan. So exciting, partner, di ba?
Yes, saka talaga partner, no, yung idea na it takes a village to raise a child, di ba? Sinasabi natin yan na hindi lang si teacher, hindi lang si parents, lahat tayo dapat magtulungan. Nung nakikinig ako kanina po, Miss Ivy, no, nakaka-alarma na it's a national emergency. Tapos, ako bilang isang class advisor, na-experience ko din yan. Siguro itong mga teachers din po natin na nakikinig ngayon, no, we've experienced in our classrooms, lalo na sa junior high school, na umpisa pa lang ng klase, may mga ilang kabataan na tayo na hindi na tumutuloy ng pag-aaral, nag-stop, kasi malalaman natin, ay, buntis na. Kaya isa ito sa mga bagay na dapat natin talagang pagtuunan ng pansin. Seryosong usapan, pero seryoso din dapat na harapin. Saka partner, nakikita ko dito, hindi lang itong teenage pregnancy. We also need to talk about sexually transmitted diseases. At yung HIV/AIDS, na timely and relevant, sabi nga, di ba? Kasi partner, ang mga kabataan ngayon, they have the access to technology, pero ang tanong ba, tama ba ang mga nakukuha nilang impormasyon? Marami kasi sa ating kabataan ngayon na maraming tanong, pero hindi alam kung kanino magtatanong. So, tama yung sinabi po sa atin kanina that we need to see or we need to address the root cause of teenage pregnancy din para ma-address natin yung concerns po ng bawat isang kabataan na atin pong kasama sa klase o sa paaralan. Di mo, partner?
Yan, maganda na nabanggit mo yung root causes. Actually, yun din yung isa sanang gustong i-highlight sa presentation ni Yusek GP. Now, in addressing our concerns, tingnan natin yung mas malalim na issue. Ano po ba yung root causes? Bakit nangyayari ang mga bagay na ito? And actually, nabanggit mo rin, partner, yung about sa technology. May naalala din ako na very relevant concern din natin ngayon, which is ang online sexual exploitation of children. Lalo na pandemic, naka-quarantine tayo, puro gadgets ang kaharap. And it is also very alarming. May mga cases na mga nare-report na increasing na din ang exploitation of children using these devices. So, ayun lang. Marami tayong challenges, pero maganda, sama-sama natin itong hinaharap at tulong-tulong natin itong hinaharap. And we are hoping that through convergence, we can also extend beyond yung agencies na involved ngayon. At sana rin kasama natin talaga ang buong community, ang ibang private partners, marin nga, nabanggit din yung SecGP kanina, yung ating mga faith-based organizations sa pag-address ng mga concern na ito. So, at dahil dyan, we will be moving forward with our program. Nag-create po tayo ng isang programa kung saan natin makikita ang pagtutulong-tulong ng mga bawat government agency. And we will be showing you this through a video.
Let's watch this.
Sino kaya ang pwede kong lapitan?
Malaki na ako. I believe that it's my right to learn about these things.
I choose to know more about my health.
Pero parang di kasi sure si nanay sa sagot niya sa mga questions ko last time.
At ang biro pa ni tatay. Naku, tigilan mo yan. Bata ka pa.
Napag-usapan naman namin to sa klase. Sabi nila, wag munang mag-boyfriend o girlfriend.
Pero in love na kasi ako eh.
Mahirap din daw magkaanak habang bata pa. Kailangan din makaiwas sa sexually transmitted infections o STIs.
Paano ko gagawin yun? Ang dami kong tanong.
Saan kaya ako dapat pumunta?
Paano kaya kung gusto kong malaman ang tungkol sa responsible sexual behavior? O kaya paano magpa-test kung meron kang STIs?
Pwede na kayang mag-avail ang mga teens gaya ko ng contraceptives? Balita ko, kailangan ng parents' consent para doon. Saan at sino kaya ang mga tamang tao na pwede kong lapitan nang hindi ako ma-judge?
Kailangan kasi namin tong malaman so we can make healthy choices for ourselves before it's too late. Ang cool siguro kung alam ni nanay at tatay at nila teachers kung saan kami pwedeng pumunta.
Kung gusto naming makakuha ng ganong klase ng information and services. Sana all meron!
Nag-gets ka namin, kaya nandito kami para suportahan ka. We are taking a step forward to understand and find ways to help you better.
At sisimulan natin yan through the CSE ARH Convergence.
The CSE ARH Convergence ensures appropriate health services for learners through strong referral links to adolescent-friendly health facilities.
Nagtutulungan ng iba't ibang ahensya ng pamahalaan tulad ng Department of Education, Department of Health, Commission on Population and Development, pati na rin ng USAID, kasama ng ibang development partners para sa inyong kalusugan.
Sinimulan ito sa 2019 Teenage Pregnancy Prevention Summit. Ang goal natin ay masigurong you can make informed and healthy choices to maximize your potential sa pamamagitan ng full implementation ng Comprehensive Sexuality Education or CSE.
At sa pagiging available ng Adolescent Reproductive Health o ARH services sa mga eskwelahan na isa sa mga flagship program ng OK sa DepEd.
Dahil pag may CSE, mahalagang nandyan ang ARH services. Dito, kapit kamay nating palalakasin ang kapasidad ng mga pamilya, eskwelahan, health facilities, local government units at ng buong komunidad na magbigay ng quality ARH information and medical services sa inyong mga teens.
Tutulong akong iling tayong mga kabataan sa serbisyong kailangan natin.
Magpupursige kaming i-empower kayong mga estudyante to make informed and healthy choices.
Kami naman ay magbibigay ng appropriate medical services nang walang halong judgment at sure na may confidentiality.
We will make sure that your rights are protected.
At kami naman ay magiging bukas sa usapang ito para konektado tayo. Mayroon ng katuwang sila nanay at tatay at sila teachers, kaya masasagot na ang questions mo.
Mas madali nang i-share ang mga bagay na ito sa tahanan, sa school, at sa mga adolescent-friendly health facilities.
Para may full access kayo sa serbisyong akma para sa inyo.
Wow!
Ang exciting! Malaking tulong to sa amin.
Kaya samahan niyo kami so we can make the best choices for a healthier future.
Hi, I am Sab and I am 14 years old, incoming grade 10 student at Pontevedra National High School, Capiz, Western Visayas. I am a student who believes that learning inside the classroom is essential in properly educating us. Since the pandemic started, it has been hard for everyone. The students are not in schools and the working parents have difficulty in managing their children. I am aware that some of my schoolmates and my peers already engage in relationships, and some are realizing their sexuality. With this, schools should implement mandatory sex education classes wherein we can go in-depth into the topic even once a week. I am not promoting early sex, but we should know our bodies, what our hormones can do to us, and the other changes of growing up. Let us be informed of the use of contraceptives and of the existence of HIV/AIDS. Schools can do that using TV, radio, and social media platforms where my generation is fully engaged in. Consultants different from guidance counselors who we find a bit scary at times can also help us answer our questions on reproduction, sex, and the like that sometimes cannot be answered by our teachers and those around us. In addition, the government should influence parents, guardians, or anyone in the household who kids can talk to. They also should be knowledgeable on reproductive health and influence us on positive behaviors. The target demographics should be everyone. The government should do extensive information campaigns and make reproductive health services like condoms, HIV testing, and maternal checkups accessible to everyone, including us. Hearing reminders from our family members or parents when the school ends after the day can help us be on the right path. The internet has now replaced parents in raising kids. This should not be the case. Kids should also not be raising kids. The DepEd should prepare for a safe back-to-school program for us. There should be a conducive school environment where teachers are friendly and are ready to answer our questions. Facilities that can help make school life enjoyable and programs that help us develop into healthy learners, which could go a long way for our future. And to us, we are responsible for our own bodies. It is also part of our duty to know how to properly care for them. Let us do our part by engaging and participating in these programs. We should not be ashamed of asking and being curious, for it is normal. We can also share and talk about these topics with our peers. The more we all know, the better. Let us not treat sex as taboo. When accessing reproductive health services, we should not be judged. Educate everyone of their sexual reproductive health rights. That is all. Thank you for having me.
Today's teens live in very challenging situations. They experience pandemic and lockdowns, man-made and natural disasters, service delivery disruptions, and economic uncertainties, to cite a few. Any of these factors or their combination may force them to become pregnant and mothers at an early age, driving them out of school and very likely to slide into poverty and fall victim to criminality, malnutrition, hunger, stunting, or even death. By providing them access to information and education services, we may be able to reverse their situation where they are likely to finish education and join the productive mainstream of society. The integration of CSE with relevant school subjects across the K-12 basic education curriculum is a step in the right direction towards promoting the overall health and well-being among adolescents. Enabled by Republic Act 10354 and taught by adequately trained teachers, the CSE provides knowledge and skills in self-protection against abuse and violence, physical, social, and emotional health and transformations at puberty, teen pregnancy prevention, and gender sensitivity, among many others. The human right to comprehensive sexuality education, done with due respect, diligence, and consideration of measures necessary to ensure its effective implementation without discrimination, is governed by the UN Rapporteur on the Right to Education, which states oath to safeguard. The CSE is comprehensive in that it provides an understanding of sexual and reproductive health and rights in the context of young people's lives that equip them with content and life skills they need to make informed decisions, be responsible for their sexuality, and protect their health and well-being. The CSE is beneficial in that it enables positive health-seeking behavior among teens by increasing their awareness about aspects of sexuality and gender. The CSE reduces adolescent vulnerabilities to violence by promoting bodily autonomy, self-worth, negotiation skills, and gender equitable norms. Still in its infancy, awareness campaigns on CSE should be continued to clarify CSE's coverage and limitations. These campaigns could constructively draw out the desirable features of an effective CSE curriculum within the context of the new normal and teachers' self-efficacy. While some are apprehensive about integrating CSE due to concerns about appropriateness, all the more that teachers should be supported in using scientific information to balance age, culture, and development responsiveness in implementing the CSE. With the advent of the most essential learning competencies, the CSE must be made more learning-oriented, where sessions are engaging, learners feel safer, current realities are welcome, authentic dialogue is encouraged, and higher-order thinking skills are applied and assessed. Thank you.
Magandang araw po sa ating lahat. Yes po, I agree. Napakahalaga po na matrain o makapacitate ang ating mga guro on comprehensive sexuality education at adolescent reproductive health programming. Kasi ito po ang magiging gabay nila at magiging foundation on how to deal appropriately with our adolescent youth learners in school. It could be through teaching or through service provision. In a way din po, they will be more responsive and sensitive to the needs of our adolescent youth learners. For example po, in one of our schools who happened to underwent SLAC session or the School Learning Action Cell on Rapid Heads Assessment of Learners, wherein they experienced the return demonstration on the comprehensive heads assessment, wherein the learners who were interviewed during that time are already rapidly screened high-risk learners. So after po, during po the feedbacking, ang mga guro po natin na nag-undergo ng return demonstration on comprehensive heads, sabi po nila, Ma'am, hindi pala natin alam no na may malaki or mabibigat na mga pinagdadaanan ang mga learners natin. Most of the time, nakikita natin silang tumatawa lang, easy-go-lucky, parang walang problema, but most of them pala are on the verge of thinking of ending their lives, or minsan ang iba po ay gusto nang lumaya sa kanilang tahanan, or ang iba din ay parang mas gustong sumama sa mga boyfriend or girlfriend nila para umiwas sa mga mabibigat na situation in their homes. Through this activity din po, we receive feedbacks from our learners as well. So after a week daw, may maraming learners na nagsabi, wow, bumait si ma'am ah. So with these testimonies in schools, this manifests that there would be a positive effect and change on the teacher-learner relationship if our teachers are guided through capacitation trainings on how to deal with our teens, ensuring privacy and confidentiality in making the school adolescent youth friendly, and back up with the comprehensive sexuality education and adolescent reproductive health programming concepts. This will eventually increase our learners' utilization of quality adolescent reproductive health information and services, since they will feel that they are safe and secured in the school, knowing that their teachers and other school providers are approachable, open-minded, knowledgeable, and responsive to their needs. This will also increase the school providers' confidence in referring our adolescent youth learners who will need further RPRH services or management while ensuring the privacy and confidentiality of the case, which will also boost our AY learners' trust on our program. According to Franklin Roosevelt, we cannot always build the future for our youth, but we can build our youth for the future by making sure first that our school providers are equipped with the necessary knowledge, skills, and attitude in dealing with our adolescent youth learners in schools. We know we can make our schools adolescent youth friendly, where learners can fully optimize the best life opportunities and they can really realize their full potentials that will enable them to be ready for the future and be a great contributor in building our nation.
Good day. This is Dr. Rachel Dilia of Cagayan de Oro City Health Office. At the same time, the chairperson for ISDN, or the Information and Service Delivery Network of this city. The Department of Education has been an active member of ISDN, and through this network, we are sharing services and information among the members of the network. And through this network also, we have helped establish teen centers in high school campuses in the city. The Department of Education has helped through their program, the Comprehensive Sexuality Education and Reproductive Health, on adolescent reproductive health, equipping our young girls and boys, our adolescent girls and boys, the right information so that they would have, they will be more responsible in their actions. And through lowering the teenage pregnancy, this will also help this adolescent finish their studies and hopefully proceed to college and may have a high probability on landing on a good paying job. So at the same time, this will also cut the poverty cycle. So keeping the young girls and boys in school and making sure to equip them for the future and let them finish their studies, and then so that later on they could find a good paying job. So our quest to lower the teenage pregnancy with the help of the Department of Education through the program on comprehensive sexuality education and adolescent reproductive health will really give us a hope that our adolescents would really grow to be an asset to the society. Good day.
Ayan,
Napakaganda,
thank
Miss
you
Ivy.
sa ating mga guest. Ayan, kamusta Sir
Yes.
Teacher Avangel?
Ako, Miss Ivy, habang nakikinig ako, no, ang dami ko naaalala nung teacher pa ako, anong teacher tayo na naalala ko yung mga batang lumalapit sa iyo, yung mga nagtatanong, yung mga troubles nila, lalo na pag-usaping pag-ibig, Miss Ivy.
Damang-dama ko, Teacher Avangel, yung inyong gustong pagtulong sa ating mga sa inyong mga students po yun nga ang dami pong magandang nasabi ng ating mga guests from different organization and agency, pero gusto kong balikan yung sinabi ni Sab. Ang galing lang ng mga points na na-erase kasi ni Sab, yung pong ating student po kanina na nagsalita from Capi. So hello Sab. So gusto ko lang din i-highlight yung sinabi niya na let us not treat sex as a taboo topic.
Yes.
So sila mismo, mga kabataan na mismo yung nagsasabi na we want to know what is about sexuality, what is about reproductive health. So ayun po, wag po tayong mahiya na pag-usapan ito. Yun. Teacher Avangel, so alam ko, meron ka pa rin mga stories dyan na paglapit sa'yo ng mga students mo din, ano?
Tama. Saka, alam mo, Miss Ivy, no, na talagang sa mga kabataan natin, isa sa mga nakikita natin dyan is yung paano ba nila nauunawaan yung usaping pag-ibig at yung relasyon. Kasi yan yung dyan nag-uugat yung mga maling desisyon, nako-confuse sila, tapos nagiging tendency, ang friends lang nila ang nagiging nalalapitan nila, in which na dapat ngayon we have to be very open. At pati yung mga teachers, we have to be very open and we have to be very critical sa pag-discuss sa kanila ng mga usapin na to. At lalo na yung nabanggit mo po kanina, Miss Ivy, na sex, na talagang, naku, kesa naman na kung saan internet website po sila mapadpad at kung kani-kanino magtanong, mahalaga na tayo na mismo po na mga magulang, guro na nag-train, capacitated, ay maging bahagi ng kanilang storya para mas maging tama yung direction na tinatahak nila. Di ba, Miss Ivy?
Yes, gabayan natin sila sa tamang impormasyon. Yun yan, di ba po? So ano po ang next natin, Teacher Avangel, sa ating programa ngayong hapon?
Napaseryoso ako sa part na yun, no? Kasi talagang ang dami ko naaalala na talagang nakakalungkot, lalo na kapag they are making uninformed choices. So, to continue our discussion of the CSE para sa ating mga guro and the ARH Convergence, we are happy to have DepEd's Director 4 of the Bureau of Curriculum and Development. Let's welcome Director Jocelyn D.R. Andaya to briefly discuss the comprehensive sexuality education.
The Honorable Secretary Leonor Mactolis Briones, Undersecretaries, colleagues in the Department of Education, our friends from the media, development partners, esteemed parents, our dear learners and other stakeholders, good morning, maayong na aga, magandang umaga sa ating lahat. Today, there are more young people in the world than ever before. In the Philippines alone, there are 30 million young people between the ages of 10 to 24, which account for 28% of the country's population. And we all know for a fact that the global health situation has been aggravated by the COVID-19 pandemic. And the youth within this age bracket are one of the most vulnerable sectors who are prone and are exposed to more health hazards and other kinds of health risks. We also know for a fact that crises and emergencies do not stop our learners from experiencing changes almost in all aspects of their personhood, most especially in the physical and emotional aspects. These changes certainly affect their health and well-being. Thus, it is important for them to obtain reliable information and necessary services during this critical period in their lives as they deal with these new changes, these yet unfamiliar experiences and developments that directly affect and involve their bodies, emotions, and mental health, among others. The DepEd, through the Bureau of Curriculum Development, recognizes that comprehensive sexuality education, ARH convergence, is paramount to support the ideal and holistic development of our learners, which the Comprehensive Sexuality Education, or CSE program, seeks to address. CSE goes beyond the teaching of scientifically accurate information on personality development, anatomy, and reproductive health. It helps young people to handle family life, relationships, and likewise deal with the threats such as discrimination, lack of quality time and communication at home, and other social issues that has relevance to having informed and responsible choices, and likewise in advocating for gender equality. Issues that this young generation are not so accustomed to discussing with their parents at home, but would have to face or deal with it sooner than later. As such, we welcome our parents' initiative to help us deal with this parent and child communication at home. It has been emphasized that comprehensive sexuality education, or CSE, as stipulated in our RPRH law and the DepEd Order number 31 series of 2018, is life skills building at school, including the development of the learner's critical thinking and responsible decision-making skills, enhancing self-esteem, and developing positive interpersonal and intrapersonal relationships to help them navigate in their transitions to adulthood, which are all complementary to the communications that transpire at home. The CSE ARH convergence will likewise strengthen the partnership between the home and the school, which is quite crucial in the holistic development of our learners. We all know for a fact that it will always take a village to raise a child, more so to educate him or her and make him or her a productive member of the society where he or she belongs. In an interagency effort led by the DOH and POPCOM, the I Choose campaign targets adolescents to make informed choices for their reproductive health, while Konektado Tayo was created to help bridge the communication gap between Filipino parents and their adolescent children, particularly on issues concerning adolescent sexuality and development, which are not always easy to discuss at home due to the many factors that contribute to this communication gap. The Bureau of Curriculum Development, or BCD, expresses its unwavering and strong commitment in building a better future for our learners by providing them the necessary life skills found in the implementation of the Comprehensive Sexuality Education and ARH program in all DepEd schools. And this year's theme of the Oplan Kalusugan One Health Week, which is Bayanihan para sa Kalusugan, okay sa DepEd, sa paaralan at sa tahanan, only emphasizes the importance of the spirit of volunteerism from all the different stakeholders that advocate for the holistic health and development of our learners, most especially during this time when we are confronted with a global health emergency. May we all continue to advocate for the holistic health and development of our learners as we all face together this global crisis that will surely reshape the future of education and the future of our learners. Muli, magandang umaga sa ating lahat.
Thank you po, Director Jocelyn Andaya. So ang ating mga kasamahan po sa Bureau of Curriculum Development ay lagi talagang nagtatrabaho po para maipahatid ang comprehensive sexuality education sa buong schools at sa lahat ng estudyante, kinder, grade to 12. So mahaba naging proseso po ng CSE at ngayon po ay implement na po natin ito sa mga schools. Alam po, Teacher Abenzel, marami din kayo mga trainings related sa CSE at sa ARH. At ayun nga, actually madami talaga training sa mga teacher, di ba, Teacher Abenzel?
Yes, Ivy, yes.
Ayan. And to continue yung ating discussion sa ating CSE-ARH Convergence, we would also like to call on the Chief of School Health Division, Dr. Maria Corazon C. Dumblao, to present ano yung highlights ng ating DepEd ARH program. So lahat ng ito po ay galing din po sa ating masisipag na ARH coordinators. So let us watch Dr. Maria Corazon C.
Good day, everyone. I'll be presenting the Adolescent Reproductive Health Program Best Practices of the Department of Education. The Adolescent Reproductive Health Program is one of the 6 flagship programs under the Oplan Kalusugan sa DepEd for a supportive school environment, and it includes the provision of the following: counseling and psychosocial support services for reproductive health concerns, facilities for information on prevention of risky behaviors, prevention and diagnosis and proper management treatment of sexually transmitted infections, and facilities for information and referral to service providers on all responsible parenthood and reproductive health concerns. These are photos taken from the Kapit Kamay Summit 2019, various consultative meetings with CSOs, youth organizations, faith-based organizations, and also conduct of local activities with the local government units. Our partners are from the government and non-government institutions, including civil society organizations, private health facilities, and youth organizations. We also have health education and promotion activities such as symposiums and distribution of educational materials related to teenage pregnancy, HIV and AIDS, and are conducted in schools targeting learners and even parents. There are also school-based teen centers that are established with various local government units and private partners offering various services such as peer education, counseling, referral, and programs to address different adolescent health concerns. There are also capacity building activities to develop peer educators to man the teen centers or have scheduled health promotion activities for their schools. The training is in partnership with different organizations. Selected students are trained as peer educators for reproductive and other health concerns to help other learners. We have trainings on adolescent education practical training program or ADEPT and adolescent job aid or ADJA training for health personnel, educators, and school support staff. And these are conducted to ensure the delivery of quality adolescent health services to the learners. Health services are delivered in conjunction with the medical and nursing services. Learners are given health assessment, weekly iron folic acid supplementation, hygiene kits, health counseling, and HIV testing in partnership with local health providers. We have the comprehensive sexuality education, adolescent reproductive health program Convergence, and is at the core of the implementation of adolescent health initiatives in DepEd. It serves as a platform to strengthen the referral pathway from school-based interventions to adolescent-friendly health services, as there is a growing concern on teenage pregnancy and HIV and AIDS cases in the country. The legal basis for the convergence are the following. We have the United Nations Sustainable Development Goals, RA 10354, or the Responsible Parenthood and Reproductive Health Act of 2012, the Philippine Development Plan 2018-2022, and the Philippine Youth Development Plan, or the PYDP 2017 to 2022, and the DOH Administrative Order 2013-0013, National Policy and Strategic Framework on Adolescent Health and Development, and the DOH Administrative Order 2017-0012 guidelines on the adoption of baseline primary health care or the adolescent health package for 10 to 19 years old. We also have DepEd Order number 28 series of 2018 policy and guidelines on Oplan Kalisugan sa Department of Education, DepEd Order 31 series of 2018 policy guidelines on the implementation of comprehensive sexuality education, 2019 declaration on addressing the education, health, and development issues of early pregnancy, DOH Memorandum 341 series of 2020 interim guidelines on continuous provision of adolescent health services during COVID-19 pandemic, DepEd OUA Memorandum 1028-0198, advisory on the implementation of the medical nursing services and ARH for SY 2020-2021, and Executive Order 141 series of 2021, adopting as a national priority the implementation of measures to address the root causes of the rising number of teenage pregnancies and mobilizing government agencies for the purpose. The CSE-ARH convergence will strengthen the linkage of learners to adolescent reproductive health services, and through the network, it will reinforce CSE learning in families and communities, provide in-school services through the Teen Hub, school clinics, and guidance office. It will strengthen the referral system and offer protection and skills development opportunities. And it will also enhance the healthcare providers network and information delivery network. The components of the CSE and ARH convergence include forging partnerships, tools and materials development, training and capacity building, delivery of quality services, monitoring, evaluation, and learning. The pilot areas for SY 2021-2022 are the selected secondary schools in targeted 8 regions with high incidence of teen pregnancy, schools with strong support of LGUs and line agencies, and the presence of other stakeholder groups, including availability and accessibility to quality services. The pilot program will be implemented this year with our ARH development partners such as USAID, POPCOM, DOH, and LGUs, and other local partners. Partnership plays a vital role in the implementation of ARH programs, and we would like to congratulate our partners for their continuing support to our programs. I would like to end by sharing the quote from Henry Ford: "Coming together is the beginning, keeping together is progress, working together is success." Thank you very much.
Yeah, thank you po, Dr. Dumla, for presentation po of the CSE-ARH Convergence at na-highlight din po ang iba't ibang initiatives ng ating mga ARH coordinators sa field sa kanilang programa po. So, anong masasabi mo, Teacher Avandel, ngayon na narinig mo na ano yung need ng ating convergence?
Pero nakakatuwa itong convergence na ito, no, saka nakakataba ng puso kasi mas maganda talagang malaman na ang ating mga learners ay may mapupuntahan outside, inside of the school, lalo kapag may mga concern sila. Alam mo, Miss Ivy, naaalala ko tuloy yung mga eksena na minsan may mga estudyanteng lumalapit sa'yo na, "Sir, mahal ko po siya. Sir, bakit po ganon? Sir, iniwan niya ako. Sir, ayoko na po. Sir, confused ako." Alam mo, ma'am, marami sa kabataan natin ngayon ang aminin natin, hindi na nakakapag-open, lalo sa mga magulang o sa family members nila. At sa atin, na pangalawang magulang, it's definitely a challenge din how to handle this kind of situations. Kaya napakahalaga at maganda na that we have this CSE-ARH convergence, Ms. Ivy.
Yes. Thank you sa mga na-share mo, no, Teacher Abundel. Na-imagine kita sa school habang kausap mo mga estudyante. Ayan, galing na artista. So hopefully may mga nanonood din sa atin ngayon ng mga kabataan. At sabi nga din, kanina, dapat huwag mahiyang magtanong. Ayan. Lapit po tayo sa mga tamang tao para sa tamang impormasyon. So,
Ulitin Miss Ivy, no? Tamang tao.
yes.
Okay.
Ayan. So, thank you, Teacher Abadel, for highlighting that. Kasi yun nga, marami tayong mga friends, marami tayong pwedeng lapitan. But let us choose din kung sino yung ating tamang pagsasabihan ng ating mga nilalaman, lalo na mga problemang puso. Ano nga, Teacher Abadel?
Yes, dapat.
So, ayan.
And as a friend.
And hopefully po, ang ating mga students ay nagpa-participate sa mga school-level activities na hatid po ng ating ARH coordinators po. At marami din sa community, no, Teacher Abanzel, na nag-offer din ng mga ARH programs, activities. Ayan po.
Speaking of community, Ms. Ivy, no, there are of course many health service providers outside school. And to share with us the Department of Health's program for adolescent health, narito si Dr. Beverly Lorraine Ho, Director 4 of the Health Promotion Bureau of the Department of Health, to share to us the ADA Network.
Introduce sa inyo ngayon ay yung CADA Network po. No? So this is one of the initiatives that is being spearheaded by the DOH with the help of a lot of our partners. So, syempre, kasama natin lagi yung POPCOM sa lahat ng ating mga initiatives. So ano po ba yung dahilan, no, bakit po ganito ang ating initiative? So una, klaro po sa atin na para po maging healthy, no, ang mga tao at ang mga komunidad, hindi naman to magic, di ba? So para mangyari yon, it is actually shaped by the behaviors of the people, behaviors ng sa ngayon, pinag-uusapan natin ng kabataan, pero mahalaga po na makita natin yung mga blue boxes, no, na importante din talaga yung katangian ng lugar, no? Pwede yon sa polisiya, pwedeng mga physical na structure, meron bang pupuntahang clinic, di ba? Hindi pwedeng lahat dahil lang po dun sa alam, gustong gawin ng mga kabataan yun. So what we're trying to say here is, in order for us to achieve our goals, yung mga minention po ni Dr. Chipi kanina, kailangan po meron tayong initiative to help shape the attributes of the people and also shape the attributes of the place, no? Be it their home, their school, their neighborhood, their workplace, or even our country, di ba? Dun sa mga polisiya natin. So with this, isa po sa mga areas na kailangan natin puntahan, particularly ng DOH Health Promotion Bureau, ay to make sure that communities are healthy, schools are healthy, and workplaces are also healthy. So for mga kabataan, no, very important yung communities kasi kasama dyan yung bahay ng mga tao. At yung pangalawa naman, yung healthy schools, no, kasi matagal silang lumalagi doon, especially before the pandemic. And hopefully, later this year, makapag-school na ulit yung mga kabataan natin. So, meron po kaming 7 priority areas. At ang dahilan po nito ay hindi naman natin pwedeng i-isolate lang, no, yung sexual and reproductive health issues. Kahit kabataan yan, kahit nakakatanda yan, kahit baby yan, no, or bata, no, hindi siya pwedeng magkakahiwalay. So, kumbaga, sinasabi natin, holistic yung tingin natin dun sa kabataan. Hindi naman pwedeng SRH issues lang ang pag-uusapan natin, tapos hindi natin pag-uusapan, kunwari, ang diet and exercise, no? Kasi most often than not, they're all linked together. At minsan, dahil may sexual and reproductive health issues, may mental health issues din, no? So, dapat ikabit-kabitin natin po itong lahat. So with that, no, ang mga behaviors na gusto natin gawin ng mga kabataan or ng tao sa Pilipinas fall into these 7 behaviors. And you will see one of the behaviors is actually practicing safe sex, no? Really being ready. At sabi nyo nga, di ba? Sabi natin lahat, I choose, no? Maging malaya kung kailan mo siya gusto gawin, na dapat alam mo yung mga consequences at meron kang karapatan at agency, kumbaga, meron kang desisyon sa mga nangyayari sa'yo. So dahil po dito, gumawa po ang tayo kasama ng maraming partners ng mga playbooks po, no? Ano po ba yung playbooks? Ito po ay mga guide para po matulungan yung mga communities natin, hindi lang LGUs, kundi pati people's organization, na paano ba natin to gagawin sa komunidad natin. Klaro po sa atin, sa amin, sa DOH at sa POPCOM, hindi po natin to kayang gawin, no, from the national level lamang. Kasi po, yung environment kung saan lumalagi yung mga bata, lalo na mga kabataan natin, hindi naman doon sila 24/7, no? Hindi po siya kaya lang natin gawin ng isang commercial lang, no? Kumbaga, we cannot communicate our way out of this, di ba? Ibig sabihin, the infrastructure has to be really there. So, that also means na kailangan malakas ang partisipasyon ng local community para nasusustain po itong space na ito. So, ano po itong kada network, which constitutes our health promotion playbook for priority area 6. No? So sa aming mga playbook, meron pong mga laman. No? So meron po diyang maiksing evidence brief kung sakali may gusto kong mag-champion, kay Mayor, kay Gov, meron na kayong kodigo dyan. No? Yung mga nakita nyo kay Doc GP kanina, sinamarize into 1 or 2 pages lang. Pangalawa is may template, policy, or ordinance. Sabi sa amin ng mga LGU, ito kadalasan nahirapan po sila na gumawa pa ng bago. No? So may template na dito na pwede na nilang kopyahin. No? Pangatlo is may implementation checklist. Ibig sabihin, meron ng guide, no? Step 1, Step 2, Step 3. Pang-apat, resource requirement. At dito, medyo intense kami dito. Bakit? Minsan kasi kapag sinasabing, ay, health promotion yan, laway lang ang katapat niyan. Pa-advise lang tayo, mga commercial. Hindi ganun, no? So, ang sinasabi natin, para po mangyari yung initiatives on the ground, kailangan po mag-invest. At sabi po ni Doc JP at ni Yusek Mike kanina, investment dahil yung mga kabataan, yung future natin. So, kung kailangan natin ito paggastusan, we need to acknowledge the requirements, the resource requirements. Next would be the capacity building mga programs. No? Anong kinakailangan na matrain, malaman ng mga taong mag-oorganisa nitong initiative? Next is meron na pong template na communication plan na pwede na pong gamitin ng mga tao sa community. Siyempre, pwede nilang baguhin yung lengguwahe, no? Yung dialect, at pwedeng baguhin yung ibang litrato. Pero in essence, no, meron na pong magagamit na template. Then, may mga indicators din po na propose at huli po, mga frequently asked questions na pwede nang gamitin ng implementer. So, gusto natin maging mabilis siya at hindi na mahirapan yung ating mga implementers to do this on the ground. So, let's just go through the parts one by one. So, this is the evidence brief portion. I'll skip that. Then, nakalagay din po, ano ba talaga yung gusto nating gawin, no? So, because we follow this framework of the Ottawa Charter, we say that there needs to be a part on the policy, there needs to be supportive environments, community action, personal skills, and reorienting our health services. So, tuhog natin yung lahat ng mga kailangan sa baba. So, KADA means Key Assistance for Developing Adolescents Network. So, basically, we're forming a network in the communities that will serve the needs of our adolescents. So, meron po tayong example from Iloilo City na napakaganda po, no? Na nagkaroon sila ng partnership for service delivery involving LGUs, CSOs, and adolescents in providing the services. So, kunwari po, isa sa mga benefits ay yung adolescents living with HIV, mas marami po silang na-test, no? After organizing this network. So, yung gusto natin mangyari is mas ma-institutionalize pa ito. No? So, meron po tayong template, resolution, or ordinance as mentioned. Meron din pong mga specify na role ng ating local implementer. So, kita nyo po dito, no? So, the implementer, be it an LGU or be it a people's organization, needs to do the following. So, kita nyo, halo-halo siya. Merong iba nangyayari sa health facility, merong iba po nangyayari sa komunidad, no? Ibig sabihin, mga hindi health workers yung tumutulong sa pag-organize nito. So, meron din po tayong dalawang proposed na capacity building programs, no? Isa is medyo mas foundational yung course, ibig sabihin basics, no, ng adolescent healthcare. At yung pangalawa, yung health education and practical training. Paano ba kumausap, no, ng ating mga adolescents? So naglagay din po kami ng mga minimum investment sa kada network, at meron pong M&E as what we have told you. No? So merong mga input and process indicators na nilagay para po makita lang din, okay, nagpo-progress ba tayo? And then syempre, eventually, as the initiative matures, then magiging ano po siya, no? Outcome indicators na. So meron po mga sample communication materials na nakalagay. So kita nyo, dito, yan yung mga part ng playbook. So early this year, we started, no, dahil nagkaroon tayo ng mas, nag-start ng kakaunting mga resources na namigay tayo ng grants sa mga LGUs na nagtaas ng kamay at sinabing, yes, we want to do this, no? So that's our team, si Doc Fonzie at si Dasha, pumunta po, no, sa Samar, who was interested to do it. Pero ang kakaiba sa kanila, meron na talaga silang ongoing initiative called Sirak Kabataan. No? So, in-integrate lang nila to kasi before, wala yung sexual and reproductive health component pa dun sa kanilang initiative. So, because of this, no, patuloy na ino-operationalize po ito ng Samar, and they have promised us to also give us inputs paano natin ma-enhance yung playbook bago pa to ipalaganap sa mas marami pang LGUs. So what's next for next year? First is to expand our grants for 2022 onwards. So next year, may mga communities, hopefully magtaas ng kamay pa to keep this initiative going. Second is to expand our initiatives towards schools, no? Focusing on DepEd's last mile schools. So, sabi ko nga kanina, hindi lang healthy communities but also healthy schools. And finally, to strengthen, no, our advocacy and people's participation. Kasi this cannot be done at the national level or even at the regional level, or even, no, the mayor alone cannot do this. Ang talagang tatrabaho nito ay yung mga tao kung sino nagsispend ng karamihan ng time yung kabataan. So with that, sinasabi lang po namin na maraming salamat ulit sa inyong suporta at sana patuloy niyo pong i-champion, no, yung cause natin ngayon, which is malaya akong maging, no, for young people to be able to say, I choose. So with that po, maraming salamat. I end our presentation.
Thank you, Director Ho, for your presentation of the CADA Network, or the Key Assistance for Developing Adolescents Network. So ang ganda partner ng mga playbook. So binubuklat ko siya, and very kompleto na yung mga nandun sa playbook natin, at very useful ito para sa ating mga LGU counterparts. And meron din meron din mga IEC materials nakasama na din dito. So, yung sabi nga nila, complete package na. And maraming topics na nagko-cover dito, hindi lang sexual and reproductive health. Meron din about mental health, meron din about nutrition, injury prevention. So, ang ganda ng playbook, ang galing din ng DOH. Teacher Avanzel, I think you are on mute.
Yes, yun nga, partner. Sabi ko nga, parang mamimiss na nakakatuwa itong initiative na itong playbook kasi nga very interactive. At the same time, marami tayong topics na pwede pag-usapan. And also, sana din ang ating mga LGUs ay excited po to use this playbook sa ating respective barangays. And para sa ating mga teenagers, let us support this initiative. And actually, Miss Ivy, no, this can be a very good community project na pwedeng mag-partner sila school at ang ating mga LGU na para ma-involve ang lahat ng kabataan to this one. Kasi right now, we really need to make our learners busy with good and meaningful activities na lalo ngayon, panahon ng pandemic, Marami na kabataan natin nakatutok na lang sa phone and so dapat ma-involve pa sila sa mas meaningful na mga activities. At kung meron mga programa, Miss Ivy, para sa ating mga kabataan at sa mga health service providers, parents, meron din po kami para sa inyo. Let's watch these videos.
Buti na lang, hindi pa ngayon. Di pa namin kaya, di pa kami handa.
Hindi ka nag-iisa, kasama mo kami. Pagplano ng pamilya, ikaw ang mahalaga. Di ka dapat matakot, di ka dapat mangamba. Abutin ang gusto mo, kaya pumili na. Kaya pumili na. Pagplano ng pamilya, hawak ko sa iyong kamay. Kaya pumili na, pumili na.
Hindi na ako matatakot dahil handa na ako. Hindi na ako kabado, anuman ang marating sa tulong ng family planning. Alam ko, kaya ko, dahil handa na ako. Kayang-kaya mong gawin lahat ng iyong hiling sa tulong ng family planning.
Walang takot at kaba. Pag may plano, protektado.
Dear parents, nakipagkumustahan ka na ba sa iyong anak sa araw na to? Maaring madalas natin silang kasama sa bahay, pero hindi natin sila nakakakwentuhan. I'm sure marami silang questions, lalo na sa kanilang pagdadalaga at pagbibinta.
Pero baka iniisip nating masyado pa silang bata para sa usaping ito, o kaya iniiwasan natin ang usaping love, sexuality, at relationships.
Ayon sa pag-aaral, adolescence ang isa sa panahon para pag-usapan ng parents at anak ang reproductive health. Pero karamihan sa mga magulang ay nahihiya at walang gaanong kaalaman para i-open ito sa kanilang teens.
At ang madalas pang sinasabi ay, later na lang, pag malalaki na sila, hanggang ang later ay naging never. Mga parents, huwag natin kalimutan na tayo ang first teachers na ating mga anak, kaya mahalaga ang kinakausap natin sila, lalo na sa mga ganitong topics.
Nais nilang pag-usapan ito kasama tayong mga parents. Dahil hindi ito natatalakay sa bahay, naghahanap sila ng ibang pagkukunan ng impormasyon, gaya ng internet o ang kanilang mga kaibigan. Minsan, sinusubukan na lang nila ito para malaman ang sagot na tayo sanang nakapagbigay.
Kahit dumaan na tayo sa ating kabataan, it doesn't mean na we fully understand our teens. Paano nga ba natin masasabing kilala natin ang ating mga anak kung hindi tayo makikipag-usap sa kanila?
Kaya natin to mga nanay at tatay. Magiging konektado tayo sa kanila through listening and understanding pagdating sa usapang love, sexuality and relationships sa loob ng ating tahanan. Pero, teka, paano nga ba tayo makikipag-communicate sa ating mga teenagers? Naiintindihan namin na maaaring hindi nyo alam kung saan magsisimula. Kaya nandito ang Konektado tayo. Sa Konektado tayo,
makakakuha ng tips on how to talk positively with your teens.
Pwede mong simulan sa simpleng, "Kumusta anak?" habang kumakain ng hapunan. O yayain mo silang magkwento about sa kanilang crush? Or i-discuss ang kanilang personal hygiene practices?
Hanggang maging open ka na sila sa mga usapan like having a boyfriend or girlfriend. And of course, things they need to learn about sexuality, gaya ng consent at safe-sex practices.
Kung konektado tayo, marami tayong opportunities para makabanding sila at magabayan tungkol sa mga bagay na mahirap talakayin. Subalit kailangan pag-usapan.
Lahat ng yan ay kayang-kaya pag-usapan.
Basta,
Konektado
tayo.
Kamusta ka, mahal ko? Alis ba? Yan.
Singer
Di ba,
ko
Miss
talaga
Ivy,
yung
yan yung
teacher Rapunzel.
isa sa mga bagay na dapat maalala natin ngayong panahon na to. Ang kamustahin ng isa't isa. Di ba, Miss Ivy?
Yes, tama ka dyan, partner, no? Minsan kasi we are being self-absorbed na, di ba? And nakakalimutan natin kamustahin yung ating mga friends, family members, at especially din yung ating mga anak. Meron ka na bang anak, Teacher Rapunzel?
Ako wala po, pero kada taon, meron po akong 250 students na tinuturing kong anak. Yan.
Naks, ang dami niyo palang students, sir. So, ayan, konektado po ba tayo, mga nanonood po sa atin dyan? So, hit the heart button kung marami po kayong natututunan sa mga presentations po natin this afternoon. So, nakita po natin ang paalala po mula sa Department of Health about sa family at planning. And actually nga po, habang bata pa, dapat marami nang rin alam tungkol sa mga ito para pag dumating yung panahon, di ba po, meron na tayong alam pagdating sa family planning, sa pagbubuo ng pamilya. Sabi nga, may naalala akong subject ko before nung college na dapat pala, simula pa nung student pa lang ako, pinaplano ko na yung life path ko. Kumbaga, anong age ko gustong mag-asawa, anong age ko gustong magkaanak, para at least yung ating track ng buhay, di ba, will be according to my vision then of myself. Pero, syempre, no worries naman din if ever. Hindi naman natin may isipan na may mga side tracks na ganyan. Di ba? No worries. Keep nyo lang yung ating life ongoing. So, ayun, partner. And actually, tinuturo din pala ang family planning nasa CSE ayon sa ating mga kasamahan from the Bureau of Curriculum Development sa grade 8 daw po, Teacher Abanzel, sa health.
Yes, tama yan.
Quarter 2. Ayan, eksakto yung binigay nila sa akin.
And sa amin sa grade 10 din, I'm a MAPI teacher. Pinag-uusapan din namin yan sa health, lalo't bahagi yan sa ating Sustainable Development Goals na mas maging informed sila sa ating reproductive health. Yan. At alam mo, Miss Ivy, importante din na may tamang information sa ating mga parents. Sabi nga nila, we could not teach what we do not know. At as much as possible, hindi po ba mas gusto natin sa mga magulang, sana natututo ang ating mga anak?
Yes. I second the motion, partner. So, actually, dito pa rin pumapasok yung isang initiative ng POPCOM at USAID. Yung nakita po nating video kanina, yung Konektado Tayo. And marami sa mga teachers natin is actually parents na din, di ba po? So, punta lang po tayo sa Konektado Facebook page and you can find relevant information there and tips on how to talk to your child, your adolescent child, sa mga teens po natin na minsan nagre-rebel din, minsan naman napaka-sweet. So, ayun. About matters like sexual health. Yes po.
Ang ganda na, Miss Ivy, no? Yung mga ating mga materials ngayon, yung mga videos na pinapanood natin, very friendly, Tagalog na, talagang tagos sa puso na mas mauunawaan ng bawat isa. At sa ating pong mga nanonood, mga kasama po natin, meron din pong FB group for our ARH coordinators and program managers naman. You can add ARH Philippines or ARH PH to get updates on the different ARH-related activities. At baka pwede po kami makahiling to please share your program initiatives in schools o sa inyo pong community. We will be happy to see your post po, and mas maganda, let's share our best practices. Sabi nga natin, kapit kamay, tayong lahat. Para sa kalusugan, no? Sharing the right information can help someone.
Yes, thank you for that, Teacher Avanjan. Ang ganda talaga ng boses mo. So I know marami pang magaganda talagang programa na gusto natin i-share ngayon, pero dahil sa kulang yung ating oras, it will be good po to share those programs po sa ating mga pages. So, at actually, excited din akong makarinig ng mga programs na galing mismo sa mga kabataan. Meron tayong mga youth-led organizations and hopefully nga, dumami pa sila sa all parts of the Philippines. So if you are a youth watching right now, so ayan, wave kayo doon. Di ba may wave wave icon
Yes,
sa
wave
ating
tayo dyan.
sa ating comment section. So we want to salute everyone for taking action for sexual and reproductive health.
Yes. Thank you so much po. And the school could not stand alone. Part talaga ito ng isang community, and we want to thank our partners for the support not only in this program but the others as well. And ngayon, Miss Ivy at sa ating pong mga kasama, we are happy to hear messages of support from some of them. Let us hear from Director Michelle Lang Ali of USAID Philippines, Regional Director Reynaldo Wong of POPCOM, and Undersecretary Maria Rosario Vergeri of the Department of Health.
Greetings. I would first like to recognize Secretary Leonor Briones, DepEd Undersecretary Elaine Del Pasqua, DepEd Undersecretary Diosdado San Antonio, the DOH Undersecretary Rosario Vergere, POPCOM Executive Director Undersecretary Juan Antonio Perez, DepEd officers and staff, teachers, students, and partners, parents, and fellow advocates of adolescent reproductive health. Maayong hapon sa tanan. Thank you for inviting me to this event. We wish to congratulate the Department of Health on this important initiative to bring together the family, the school, and community to promote adolescent welfare. We laud you, the educators, for your constant dedication and commitment to your role as second parents to adolescents and overcoming the challenges to connect with your many school daughters and sons in this virtual environment. We thank you for being the frontliners in this important responsibility. This year, USAID is proud to celebrate 60 years of helping people around the world build stronger, more prosperous communities. USAID was founded in 1961 by President John F. Kennedy, and the Philippines is one of our very first partner countries. For the past 6 decades, we have collaborated with the Philippine government, private sector, and local organizations to improve everyday lives, investing more than $5.1 billion shared development goals since 1961. In the COVID pandemic setting, the important role of parents in adolescent education and welfare cannot be overemphasized. We would like to thank the parents who have risen up to the challenge of being health educators to their children and joining hand with school teachers in the study from home setting. Teenage pregnancy results in economic losses of up to 33 billion pesos, or 1% of GDP annually for the Philippines. A more important concern, adolescents who get pregnant too early miss out on opportunities to achieve their full potential and to be the best that they can be. USAID supports comprehensive sexuality education, adolescent reproductive health convergence at the national policy level, and its implementation at the local level, including advocating for and strengthening community participation. At the school level, it strengthens the integration of curricular instruction with holistic health services that include adolescent reproductive health. Because it takes a village to nurture adolescents, USAID recognizes the importance to strengthen the relationship among educators, parents, health workers, and adolescents in and out of school. These complement our work with the Department of Health and local government unions to establish a healthcare provider network that can address adolescent health needs. It utilizes our collective work with the Commission on Population on Conectado Tayo. Conectado Tayo is a platform to help parents and guardians of teens discuss teenage love, sexuality, and relationships confidently and comfortably with their teens. We recognize that ensuring adolescent well-being and reducing teen pregnancy requires health and non-health solutions. Beyond health, USAID supports adolescent and youth in life skills education, technical and vocational training, livelihood support, and leadership development. A whole of government approach is needed to nurture adolescents. Your continuing engagement with the Department of Health and the Commission on Population, other government agencies, and local government units for adolescent reproductive health is testament to your commitment to the present and future of this country. We join hands with you at DepEd to strengthen comprehensive sexuality education, adolescent reproductive health links, to facilitate collaboration between schools and communities, and to empower learners so that they can access age-appropriate information and services that will help them navigate adolescence. As we celebrate 60 years of partnership for development and 75 years of diplomatic relations, it gives us pride to be your partner in this effort to promote adolescent welfare. We are in this together. Again, congratulations. Maraming salamat.
Sa ngalan po ng pamunuan ng Commission on Population and Development, sa pangunguna ng aming Executive Director, Dr. Juan Antonio A. Perez III, at ang aming Deputy Executive Director, si Ginoong Lolito Tacardon, ang buong komisyon po ay bumabati at nagpapahayag ng matibay na pagsuporta sa Department of Education patungkol sa Oplan Kalusugan, bayanihan para sa Oplan Kalusugan ng ating paaralan at sa ating mga tahanan at pamayanan. Batid po ng Komisyon ng Populasyon at ng pagpapaunlad ang kahalagahan ng kalusugan para sa isang matibay na ekonomiya at pag-unlad ng ating bayan. Ito po ay dapat na nagsisimula sa mga kabataan at dala po nila hanggang sa kanilang katandaan. Ang ating pong komisyon ay walang humpay na nagpapahayag ng kanyang matibay na pagsuporta po sa Department of Education sa pamamagitan ng pagpo-promote at pag-share ng aming mga resources and capability building po ng ating mga guro sa linya ng comprehensive sexuality education sa mga paaralan, elementarya man at sekundarya, upang nang sa ganon ay lalo pang tumibay ang ating pagkakaisa sa iisang layunin na maiwaksi sa mga risky sexual at non-sexual behavior po ang ating mga kabataan upang patuloy nilang mapangalagaan ang kanilang kalusugan na siya naman talagang kayamanan ng ating bayan. Maraming pong salamat at mabuhay po ang Department of Education mula sa PAPCOM.
Magandang hapon po sa ating lahat. Pagbati sa nakikiisa sa ating ng Comprehensive Sexuality Education, Sexual and Reproductive Health Convergence na pinangungunahan ng Kagawaran ng Edukasyon. Ikinagagalak po ng Kagawaran ng Kalusugan na maging bahagi ng pagtitipon na ito. Kaisa ang kagawaran sa pagsulong ng Comprehensive Sexuality Education kung saan pinoprotektahan at tinutulungan ng ating mga kabataan upang mapag-igting ang isang ligtas at maayos na ang pagdaragdag sa kaalaman at pagbubuti ng pag-uugali ng kabataan tungkol sa kanilang sexual and reproductive health ay ang unang hakbang natin patungo sa isang healthy Pilipinas. Minimithi ng Kagawaran ng Kalusugan na mabigyang katapusan ang teenage pregnancy sa ating bansa at tayong lahat ay magsasama sa pagpapababa ng HIV cases dito sa Pilipinas. Kaya naman ngayong mayroon tayong effort na nagpapalawig ng comprehensive sexuality education, adolescent reproductive health convergence, kaisa po ang DOH sa pagsulong ng mga proyekto, programa at polisiya para mapabuti ang kalusugan ng ating mga kabataan at sa pamamagitan ng pag-connect ng mga itinuturo sa pag-aaral at ng mga programang pangkalusugan. Dagdag po dito, patuloy po ang DOH sa pagpapalawak ng support ng mga kabataan sa pamamagitan ng ating Healthy Schools at Healthy Communities portfolio ng Health Promotion Bureau at Disease Prevention and Control Bureau of DOH. Meron po tayong Health Promotion Playbook on Sexual and Reproductive Health na tinatawag na KADA Network or Key Assistance for Developing Adolescents Network, kung saan ating ginagabayan ang ating local government units sa pagbuo at pagpapatupad na nagbibigay ng tulong sa pagpapaunlad at pagpapabuti ng kalusugan ng mga kabataan sa ating komunidad. Ang mga youth-friendly at exciting na mga mensahe at abiso sa ating mga kampanya para sa ating mga kabataan gaya ng I Choose, Malaya Akong Maging at Konektado Tayo communication campaigns ay patuloy din po nating pinapahatid at mas pinag-iigting sa tulong ng iba't ibang ahensya ng gobyerno, mga civil society organizations, NGOs at development partners. Ngayong pinagdadaanan ng ating mga kabataan ang isa sa pinakamahalagang panahon ng kanilang buhay, sama-sama nating silang suportahan sa pamamagitan ng pagbibigay ng mga wastong impormasyon at plataforma kung saan malaya nilang mapag-uusapan ang mga sexualidad at ng mga pangangailangan para sa kanilang sexual and reproductive health. Gawin po natin isog ng mga kabataan para sa isang masayang pamilya at para sa healthy Pilipinas. Maraming salamat po.
Thank you so much, Director Elan Ali, Regional Director Reynaldo Wong, and to our Undersecretary Maria Rosario Vergeri of the Department of Health. Partner, Ms. Ivy, we are at the end of our program at marami na tayong na-share at napag-usapan mula sa mga activities sa schools, hanggang sa community, at para sa mga magulang, pero din tayo po para sa lahat sa ating LGU. And I am thrilled that the government agencies are working better together. Alam mo, Ms. Ivy, ang baon ko sa araw na ito, no? Para sa ating mga learners, laging tandaan, you are not alone. At para sa ating mga kasamang guro at mga magulang, atin pong pakinggan ang boses ng ating mga kabataan. And para po sa lahat, ituro natin sa ating kabataan ang tunay na kahulugan ng pag-ibig. Kabilang narito ang pagmamahal sa sarili.
Yes, I agree, partner. And I also want to leave a message then for our viewers, especially our youth. Diba? Yes, we are talking about sexual and reproductive health, but more than that, every one of us working sa field ng adolescent health are excited for the bright future each one of you can have. So I know yung lahat ng parents, teachers natin, ang ating mga health personnel would want what is best for you. And to everyone po, diba, let us know our worth and be hopeful and excited for our great future. So sabi nga, diba, malaya kayong maging kung ano ang mga pinapangarap niyo.
And we hope na lahat tayo ay magkapit-kamay at magbayanihan for adolescent health. With that, let us have Director Lope B. Santos III from the Department of Education's Bureau of Learner Support Services for a closing remark.
Maraming salamat po sa inyong walang sawang suporta sa Adolescent Reproductive Health or ARH program. We are glad that we are strengthening the convergence of our initiatives with the Department of Health, Commission on Population and Development, and USAID. Ang adolescent reproductive health ay isang mahalagang bahagi ng offline kalusugan sa DepEd na naglalayong ibigyan ng sapat na impormasyon at kaukulang serbisyo ang ating mga kabataan pagdating sa reproductive health. Ang programa ay sumusuporta din sa comprehensive sexuality education kung saan isinasama sa aralin ang mga mahalagang konsepto para maunawaan ng mga mag-aaral ang pagbabago sa kanilang katawan at paano ito mapaghahandaan. Kung kaya't pinapalakas pa natin ang comprehensive sexuality education, adolescent reproductive health convergence sa pakikipag-ugnayan sa ating mga health service providers. Sa pamumuno po ng ating kalihim, Leonor Magtolis-Briones, kasama sina Undersecretary for Administration Alain Del Pascua at Undersecretary for Curriculum and Instruction Diosdado San Antonio, Bureau of Curriculum and Development Director Joyce Andaya, at School Health Division Chief Dr. Maria Corazon Dumlao. Nais nating pasalamatan ang ating mga panauhin at resource persons na nakapiling natin ngayong araw. Sina Undersecretary Maria Rosalie Bergery ng Department of Health, Undersecretary Juan Antonio Perez, at Regional Director Reynaldo Wong ng Commission on Population and Development, at Director Michelle Ali ng USAID. Kasama po natin ang ating mga partners simula pa noong pagpasa ng reproductive health at responsible parenthood hanggang sa paglabas ng Executive Order 141 na binibigyang solusyon ang adolescent pregnancy. Nais ko ting batiin at pasalamatan ang ating School Health Division kasama ang ating mga School Health and Nutrition personnel sa regional at division offices at sa ating mga paaralan. Nais po namin magpugay sa suporta ng ating mga regional directors, school division superintendents, mga school heads, at mga kasama sa central office. Sa paglulunsad natin ng One Health Week, handa na tayo sa balik eskwela. Handa na muli sa pagsuong sa blended learning. Para sa kalusugan, para sa kabataan, para sa bayan. Mabuhay po kayo.
Tara na okay, Offline kalusugan sa DepEd.
Mabuhay din po kayo, Director Santos, at mabuhay tayong lahat. Thank you for staying with us until the end of this live stream. Para po sa inyo, you can access the Certificate of Attendance on September 13 using the DepEd Learning Management System. This is open to DepEd and non-DepEd viewers. Just create an account using your email. Muli po sa inyo na aming mga bagong partners na sa labang ito. Maraming salamat po sa inyong pakikisa sa ating launching of the Comprehensive Sexuality Education, Adolescent Reproductive Health Convergence. This has been Sir Avangel, your national teacher broadcaster.
Thank you, Teacher Avangel. And again, I am Ivy from the School Health Division. See you tomorrow po for another session of the One Health Week. Bayanihan para sa kalusugan, okay sa DepEd, sa paaralan at sa tahanan. Salamat po sa lahat!
Kids! Okay sa DepEd! Thank you, Miss Ivy.
I have once read that saying thank you is just a waste of time. And I don't definitely agree with that. Saying thank you is one of the kindest deed and expression. So today, I'd like to give my beautiful, beautiful thank you to all the key people on this event on our fourth day of the Okay sa DepEd One Health Week Celebration 2021. First, I'd like to say my beautiful thank you to all the school nurses for their untiring moments and sleepless nights. And to all school program coordinators and school focal persons on ARH. Beautiful thank you din po. So after today, there will be a tomorrow. Alam ko po yun at alam nating lahat. So tomorrow, I will catch you all again. Huhuliin ko po kayong muli. Because tomorrow we will be presenting one of the flagship program of Okay sa DepEd, which is mental health. Tomorrow will be an amazing day because we will celebrate the School Mental Health Day. Please do not log out. Do not sign out. Have your internet connectivity stable because we will see you all again tomorrow. Please stay safe, everyone, and have a good day.